Hello, my name is Steve Ronan of Blackhawk Plastic Surgery. Welcome to BPS Live. This is our 4th edition. I'm here with my friend Brette. 18 years this July, Brette will have been here. I've been trying to get rid of her this entire time, and she never goes. So we've kind of gotten used to her, but Brette, go ahead, take it away.
Hi, everybody. Thanks, Dr. Ronan. I'm not going anywhere yet. Well, I love doing this with you. This is so much fun. This is our 4th episode already, and our audience keeps getting bigger every show. So welcome, and thank you for your interaction and the chatting that we're going to do today. We decided to move our times to 6:30 so that more of you can join us. And why don't you introduce the topic of tonight's episode, Dr. Ronan?
Sure. So tonight we're going to talk about skin laxity, and historically the most common way we will have dealt with that would be a surgical procedure with excising or removing skin. But tonight we're going to talk about a new technology that's out there where we could actually remove skin in a less invasive way that doesn't leave a scar. And we have a special guest tonight, and our guest is Jason Richie of Cytrellis, who makes the ellacor device that we're going to talk about tonight. And he's online with me here. And Jason, you want to introduce yourself? Talk a little bit about ellacor?
Absolutely. My name is Jason Richie. I'm the president and CEO of Cytrellis Biosystems. I've had the privilege of working with Dr. Ronan now for going on 8 years, and it's great to be working with him on this special project as well. At Cytrellis, what we have is a brand new technology called ellacor, which utilizes dermal microcoring. So essentially what we're doing is we're removing skin at a micro level and able to reduce skin surface area without the need for surgery, sutures, or scars. This is a device that was invented at Mass General and Harvard by some very, very brilliant scientists that came up with the idea that said, how do we really go after this lax skin that just doesn't seem to respond well to energy-based technologies? And before ellacor, the only alternative was really excising that skin with a scalpel. And so it's really neat to have a new treatment modality to go after this kind of tough, creepy skin. And so I've had the opportunity to work with this company now for 2 years, and it's really exciting to be on the show to tell you more about it.
So that's great. Awesome. Thanks for coming. So we go way back. We've actually been working in medical devices together for quite some time. And so it's good to have a new device to work together on. And we'll talk maybe a little bit later about some of the new things that might be coming with the device. Brette, do we have any announcements?
Yeah,
before
I do.
we get going?
Thank you. I have a couple things. So first, at the end of the show, we'll do our Q&A session. So you viewers have time to log on and ask questions in the chat, and we can answer them live with you. And special announcement, I don't know if you know this, we have online booking now. So if after hours you want to jump online and book an appointment with Dr. Ronan, you can do so from our website, blackhawkplasticsurgery.com. And we'll share a QR code at the end of the show. Dr. Ronan, back to you.
Awesome. All right. So just did a quick review. So historically, to tighten skin, we've had to cut out or remove skin. So that meant a surgery. And then over the last several years, there have been some devices, radio frequency ultrasound, that sort of make claims to do skin tightening that have been mixed in their results. And so now we're super excited about a new technology that removes tiny cores of skin that are so small that when they collapse, they don't leave a scar. But when you add up 18,000 cores or 20,000 cores, it really makes a more significant amount of skin that's removed. It's not quite as much as surgery, but it's a lot better than what's available on the non-invasive side. So with that, we'll start with our first feature and come back at the end for some Q&A. Please leave your questions in the chat for us, and we'll be happy to get right on them afterwards. Tonight, we're going to give you an overview of an exciting new skin tightening treatment called ellacor. ellacor Skin Rejuvenation is a non-invasive, advanced skin treatment designed to target a wide variety of concerns, from fine lines and wrinkles to uneven skin tone and texture. This procedure uses state-of-the-art technology to stimulate collagen production, promoting skin elasticity, more youthful appearance, and tightening of skin. At the end of this event, we're also going to have a question and answer session where I'm going to answer any questions that you have. So at any point during tonight's virtual event, you could submit your questions via the questions tab. So please submit those all along the show. ellacor is a new skin rejuvenation treatment that leverages the power of microcoring to transform the skin and offer some restoration. It's a pretty remarkable promise because we can provide tightening without scarring. So what is microcoring? It's actually a cutting-edge technology where we take out a tiny core of skin so small that when it heals, it doesn't leave a scar. And if you remove 18 or 20,000 tiny cores, you can actually provide a significant amount of tightening. So on a face and neck, we might remove 18 or 20,000 tiny cores of skin, which are very small needle sticks. But as those all contract down, they heal without a scar, and they provide a fair amount of tightening with a minimally invasive procedure. What makes ellacor unique? Well, ellacor is a skin tightening device that's a new technology that's quite a bit different from the existing and older technologies. So we're not using heat to try and contract the skin. Heat, skin contraction is okay. With ellacor, we're actually removing skin, but we're doing it in such small amounts that it doesn't leave a scar. And so this is the first time that I'm very comfortable saying to someone in a minimally invasive way, we can really tighten up your skin. It's a pretty significant advance over the other energy-based devices that claimed to tighten skin, but only minimally tightened it. With ellacor, we can actually remove 7 or 8% of your total skin volume. And it's not like doing a surgery, but it's certainly a significant amount when you need a small amount of tightening. So what areas of the body can ellacor treat? Well, it was initially designed to work on the face, so sort of the neck and jowl area. But within the face, we can do, the cheek area to provide help with the jowl. We can come across the neck to provide tightening there. We can go across the lips, which provides tightening of the lip area and really shortening of the upper lip. We can also do some in the forehead, especially laterally, which will kind of mildly elevate the brow. And that's on the face. And then there's other areas that we're sort of expanding into. One of those would be upper arms. So I can tell you that for the last 15 or 20 years, I've had so many people come in my office and ask me about upper arm skin laxity. And the typical or standard treatment for that is something called a brachioplasty, where you're making a long scar on the arm. And so most of our patients don't have enough laxity to warrant that scar. And so I tell them, sorry, not much I can do for you, including my mom, who's for 20 years asked me to fix her upper arm. And I kept telling her, sorry, that scar is too much. So now we have something we can offer patients. So if you have a little bit of laxity on your arm and you're willing to undergo 1, 2, or 3 ellacor treatments, we can actually tighten up the skin on the back of the arm. Another place would be above the knee or the supra knee area, because sometimes that area will get a little bit of laxity. And that's a difficult one to treat surgically. And so if we can get some tightening in the supra knee area, I think that's fantastic. Inner upper thighs would be another area. And then on the lateral thigh, just below and outside the buttock, are pretty typical areas where you can get a little bit of laxity. And if you have a little bit, an ellacor procedure, bringing some tightening in can make a difference. Now, in any of these areas, if you have a lot of laxity, then there's really not much a minimally invasive treatment's going to do, and then we would talk about having surgery. But when you come in for an appointment, we'll go over any different areas, and we'll talk about what is the pluses and minuses of doing surgery versus a minimally invasive. And so we're happy to do that at your consult. I'm asked some very common questions about ellacor, and here are a few. First one I get is this a painful procedure? And with this procedure, I'll inject some numbing medicine. So in the area we're going to treat, we'll inject some numbing. That stings a little bit, not too bad, but we sort of get through that, and then the rest of the procedure doesn't really have any pain because we have you numb, essentially. After the surgery, it's pretty minimal. You'll kind of feel like you have a sunburn. Another common question is, how long does it take to recover after an ellacor? The holes will close down fairly quickly, especially with a little bit of swelling. It'll kind of push them all close, collapse in. And so the holes will be closed, very quickly. And you'll feel a little bit irritated raw for the first day or so. And after that, it's really a matter of just redness. Your skin will be a little bit red or kind of look sunburny for a little while. Now that might be as short as 3 or 4 days, and it might be as long as 2 or 3 weeks. And it sort of just depends on you a little bit. After about a week, it'll be coverable with makeup, but that's really what the recovery is about. It's just sort of like getting over the first few days where you're a little bit raw, and then after that, dealing with the redness. The last question we get is, when do you see the results? And it's probably over months. And the reason I say that is you got to get rid of all your swelling. That's usually a week or two. And then the healing process has to take place. And with all of those mini injuries, your body is laying down collagen. So it's a collagen induction to heal that and contract that down. So you make a whole bunch of collagen that's over a period of time, and then you start to remodel that. And that takes a while. So it takes really months to get to your final result. Are there any procedures that pair well with an ellacor procedure? Yes, in fact, there are. And here at Blackhawk Plastic Surgery, there's sort of a trio of procedures that we do together with an ellacor. And that would include fat grafting of the face, laser resurfacing, and then ellacor microcoring. And so what does this combination of procedures do? Well, the cause of facial aging is loss of fat or volume loss. And as that happens, the face deflates, hollows out in the lower lids, creates the jowl. And of course, there's lots of sun damage and wrinkling and brown spots and that kind of thing. So this trio of procedures provides fat grafting to revolumize the face in a natural way. It doesn't look swollen and puffy like fillers. It looks entirely natural. We can get a large amount of volume back into the face. We can do ellacor on the areas with some laxity to sort of bring that skin in and tighten it up a little bit. And then we can do laser resurfacing on the whole face to take care of brown spots, sun damage, fine lines, texture, and wrinkles. And so really that makes a very nice combination of procedures that we can do all at one time in about an hour. Let's take a look at some before and after pictures for ellacor. So you can see here that this patient had ellacor along the cheeks and along the upper neck to provide some sort of tightening in this area. Also had a little bit of fat grafting, so you'll see that volume coming across and under the lids and the cheekbone area. And then had laser resurfacing to work on the texture, wrinkles, and coloring of the skin. And so all of this really packages pretty well together to provide some lift and tightening, but no scars and a very easy recovery. This patient only had ellacor. And so you can see the tightening along the cheeks and along the upper neck with a little bit of tightening from the ellacor procedure. This last one's one of my favorites. And so it shows a very nice result, dramatic result with the ellacor procedure and the skin tightening. So let's move on to some more questions and answers. Brette, what you got?
Hi guys. I have lots of great questions in the chat that I'm going to get to. One of the big questions that I think everyone will like is, how is this different than anything else?
So that's a great question. And I think I'd like to bring Jason back in on that. And it really is a new class of skin tightening. And so Jason, you want to hop in here?
Sure. We get this question a lot. And I think the whole aspect here is that we're actually removing skin. So I would think about this like a punch biopsy. So full dermal thickness core that's being removed at a micro level, a diameter of under 0.5 millimeter times 10,000. And so we're actually able to remove the skin surface area and simultaneously and dramatically upregulate collagen and elastin production. So it's a whole new class of technology that's so different than everything else, because all of our technologies are really focused on inducing some form of thermocoagulated damage, if you will. So RF microneedling, lasers, high frequency ultrasound are all designed to induce some kind of energy-based injury, which then stimulates collagen and elastin, but it doesn't remove skin. This is the first technology out there that can actually reduce surface area. And so that's why I think we've seen so many people do so well, because it's able to reduce that skin. You just have that stubborn, lax skin that just not receive energy.
So that's great. I have a question for the audience. So if you have a 0.5 millimeter diameter and then you do pi r squared, so it'd be 1/4 millimeter squared times pi times about 18,000. Whoever gets the right answer in first is going to get a prize. So, because we want to see who's good at math. Brette, what else do we have for questions?
That's definitely not me.
Yeah.
Okay, let's start with some questions. Tanya, she is asking, does it work on the jowl area?
Yeah. So the jowl is one of the primary treatment areas, and that's where the study was done with the device. And so when you tighten, around down the cheek area, that will contract the skin, and that will help improve the jowl. So yes, it's definitely a nice treatment for jowls that are more mild to moderate. Once they get a little bit heavier, then we need to talk about doing surgery.
That's great. And this kind of also goes with Joseph's question. I know we talked about in the video, it works on the neck, but what about under the neck?
So under the neck, do you mean not under the chin, but on the neck? Yes. So yes, we can do coring under the chin and then down the neck as well. And so it's a popular spot. The two most popular areas that we treat are on the face and the neck.
Victoria, how much does it hurt?
We numb you up prior to the procedure. So it stings a little bit to do the numbing. So I'll numb this area up. And then when I'm actually doing the procedure, it doesn't really hurt because you're pretty numb for it. It makes some noise, takes a little bit of getting used to that, the device will make some noise when it's working. But once you sort of get over that, it's pretty comfortable.
Joseph?
Let me ask Jason. So I believe you've had this procedure, and a couple questions. One would be, how much did it hurt? And what was your recovery like? And how long did that take? Because I'm sure we've probably gotten asked that question already a few times.
Yeah.
Many times. And so I would tell you that the pain, actually, if you want to watch my procedure, go to ellacor Skin on Instagram and you can watch it. It's there. The pain for me was nothing. And I'm actually a big baby when it comes to pain, but I had a nerve block and some tumescent anesthesia, and I literally felt nothing, just a little bit of pressure. With proper anesthesia technique, you just don't feel much of anything at all. Recovery for me was also one of those things to where you call it for the first couple of days, you're pretty red. You've had skin removed, and so you're going to have some redness. But then by day 3, that red turns to pink. If you wear makeup, you can apply makeup probably after just a couple of days, and then you're good to go. My healing cascade was probably 3 days that I was pretty red. Then I turned pink, and by day 7, I was pretty well good to go. Never did I have pain, though. And that was something that was funny when people would first look at me. I was a bit swollen after the procedure, and I was red, and people thought, oh, my goodness, does this hurt? And I can tell you, honestly, I felt no pain at all. On the day after the procedure, it felt more like I had a dry mud mask on my face than any form of pain or any burning or anything like that. I never felt any of that. But the total healing cascade for me was about 7 days. In which you'd say after day 7, people were none the wiser that I had the procedure. What's interesting, though, is that what I continue to feel, and I'm 2.5 months out from my first procedure, and a couple of things. Number one, I still feel tight. My face feels like definitely something happened. I can feel it in the morning when I'm on the treadmill. It feels almost like your skin went to the tailor and it just fits better. Number one. Number two, we did an upper lip measurement, and my upper lip shrunk by almost 2 millimeters, 1.89 millimeters to be exact, after doing one procedure at 7% here, which was really cool. So now I have pretty lips. And then the final, the final piece of this was that I had a traumatic scar down my face from an injury that I had in my 20s, and it's far more difficult to see now and much more superficial. So I'm going to have my second procedure probably in the next month or so, and I'm really excited to see what could happen with that. But honestly, no pain. Total healing time was about a week, and what I feel more than anything is just tightness. but a good tightness, not a tightness that's uncomfortable, but one like my skin feels like it fits better.
Well, that's great. It's obviously worked for you. You're looking good, and tonight your makeup is definitely on point. So, Brad, your next
I
question.
spent a lot of time,
Yes. Tanya was chiming in. After the initial procedure, how often do you need to get it done?
Good question. And I think there's a wide variability for the answer. Some people might do this once. Some people that need more tightening are going to need to do it a few times, maybe 2 or 3. And it also just depends on your skin tone. Some of us are blessed with skin tone that is really good and does very well, and others that don't really have that greatest skin tone. Every facelift I do, every breast lift, every excisional technique, we tighten it up, but then there's some little bit of loosening, and a lot of that is dependent on the patient's own skin. And so if your skin tone's not so good, you're going to have to do more work than someone whose skin tone is generally in good shape. And so we can figure that out, and I can usually tell up front what someone's skin tone's like and about how much tightening they're going to need, and we can sort of determine if it's likely to be a one and done or a serial type procedure.
I have a question from Sonia. What's the downtime like after the procedure?
So downtime, a little bit like Jason described, you're going to be red and a little bit raw and sort of tight feeling. There'll be swelling. That will largely go over a few days. And then you'll have a redness that will turn to sort of more a pink hue. That will transition, will take around day 3 or 4. And then after, a period of time, you can put on a little bit of makeup and cover up the residual redness, which, might be a week, might be a little bit longer.
Jasmine wants to know, how long does the procedure take?
The procedure, if we're doing it by itself, it's probably about an hour, maybe a little bit less, actually. And that would include, all the numbing part and then doing the whole procedure. And then we'll typically do like an after care oxygen, like facial mask thing for most patients afterward. A lot of the time we're doing this in combination with other procedures, for example, fat grafting or laser. And so that'll add a little bit more to the overall time.
Perfect. That actually answered Ava's question. So perfect. I also have a question, and one of our chats says, what does it mean, skin tone? Can you elaborate on that a little bit?
Skin tone. Yeah, sure. You could see people who have skin around their arms or legs or face or neck, and it just seems kind of tight. And if you pull it away, it snaps right back. And so that's like really good skin tone. And you can see other people who their skin's sort of hanging off their arm or their face or their neck, and maybe it looks kind of sun damaged. And so in that case, the skin tone is not that great. So it's either like a decrease in elastin, or it has been a significant weight loss and they've kind of shrunk a lot more than their skin. And so at that point, their skin tone's not that great. And so depending on all of those things, we can gauge which the right procedure for you and how much procedure to do.
I'm probably pronouncing her name wrong, but it's Isla. How does weight loss affect skin laxity? Are there specific treatments that can help tighten loose skin after significant weight loss?
So significant weight loss, we'll call that maybe 40 or 50 pounds or more. Super common. Used to be more common with bariatric surgery, but now with the advent of semaglutide and all the other weight loss medicines that are out there, we're seeing a lot more patients with weight loss. When you have a significant weight loss, if you can grab a bunch of skin, then you're going to be more likely a surgical candidate. And so most common thing would be like a tummy tuck. Someone loses 50, 60, 70, 100 pounds, and they have a bunch of extra skin on their belly, maybe droopy breasts. And in those cases, we're more likely going to do some sort of an excisional technique like a tummy tuck or a breast lift. If you have a smaller to more moderate amount of skin laxity, then we'll consider doing a less invasive thing like ellacor. And so it's just a matter of how much skin do we need to remove? If we need to remove a smaller amount, then we might use ellacor. But if we need to use really a large amount, then we'll be doing surgery.
I have one from Renee. Hey, Renee. Question is, results to an actual facelift, and do you eventually need a facelift?
So the first thing is that no one ever needs any of the stuff here. This is all want-based. You don't have to do it. You're volunteering for all of it. And so that's kind of important to keep in mind, is that we're here to try to improve people and make them better. And this is all sort of voluntary. You don't have to do it. Will it compare to a facelift? No. It's simply not a facelift, and a facelift is a little more complicated with not just removing skin, but elevating tissues, and so it's not a substitute for that. But it's something that is done before, after, or as an adjuvant to a facelift. And let me tell you what I mean by that. I saw someone today who came in, a physician's wife, and she was telling me that she was concerned with jowling and tired eyes and a little bit of skin laxity on the neck, and was like a little earlier in the process. She said, "Do I need a facelift? Or I'd rather not if I don't have to, but is there something I can do now that would maybe push off having a facelift?" And so that's the perfect patient for this procedure. So we recommended doing fat grafting to replace her volume loss, laser resurfacing to work on the sun damage and wrinkles, and then ellacor to provide tightening and texture improvement. And so she's pretty excited about that. And that will be a much smaller procedure for her to do. It'll really give her a nice boost. And then when she's ready down the road, we can do a face. And sometimes with the face, we'll also do an ellacor to work on texture, and especially around the mouth or across the forehead. And then after someone has a facelift, some years go by, a little bit more laxity comes along. We might do an ellacor plus minus a fat grafting procedure or laser as a tune-up to a facelift. So if you had a facelift in the past and you want a tune-up, this is a great thing to do. So it's done before facelifts, after facelifts, and then sometimes along with a facelift.
And Joseph was actually asking about fat grafting. So thank you for clarifying that. He was asking if it's like a filler.
Yeah, so fat grafting really is the ultimate filler. When we do fat, it's replacing the volume that you originally had in your face. As we age, we lose fat in our face. And so putting fat back in is a great idea. When we do it, it's typically a lot more volume. So when we do fillers, by a syringe, we might do 1, 2, 3 syringes. When I do fat grafting, it might be 30 or 40 syringes. And it tends to be long-term or permanent. It also talks to the skin and makes it look better.
Dr. Ronan, Madison wants to know, how does ellacor stimulate collagen production?
Great question. Let's go to my science guru friend. What do you got from the lab on collagen production?
Actually, really interesting data. We see rapid and accretive collagen production. And what's happening here is, although we're not using energy, we are still creating an injury when you're punching through the skin, even though it's at a micro level. So as Dr. Ronan was saying, imagine 14,000, 15,000 of these micro punctures into the skin. All those areas create an injury, and then the body's natural response to heal that injury is neocollagenesis, which is elastin and collagen coming to the rescue. What we've seen that's really interesting with this technology, though, is that it's accretive, meaning that if you do one procedure, it will rejuvenate a portion of your collagen. And then if you do a second procedure, it will dramatically increase the collagen prior to the first. And that's something that I think we can justify to the fact that we're leaving no thermocoagulated tissue behind, which could potentially leave scar tissue. Because we're below the scarring threshold, everything that we're doing here is very natural. And as a result, you're seeing this accretive neocollagenesis that happens with subsequent procedures. And that's why all of our patients are saying, number one, my skin feels tighter, but it just feels more youthful. It just feels healthier. And we see that across the 10,000 procedures that we've done since we've launched this technology.
So I recently had a a meeting with our friend Shiv, who's the Chief Technology Officer at Cytrellis, who's a great guy, a lot of fun. But I thought maybe we could talk a little bit about what's coming soon and what's coming maybe a little bit down the road for Cytrellis at ellacor.
Sure. Innovation's a big thing for us. Whenever you have a new
and also, like, I know there's probably some things you can't talk about, so I don't want to put you on the spot.
No, it's okay. It's okay. We'll talk about, right now, when we launched this technology, as you said, it was really designed for the face. That's where we did our pivotal studies. That's where we've launched the technology. But what we found is that the mechanism is the same no matter where you go. So we are actively innovating not only on the body front, but getting FDA clearances to treat all areas of the body. We've done an abdominoplasty study. We've done a neck and submentum study. We continue to do studies looking at things like brachioplasty, inner thigh, above the knee, abdomens in particular, even the décolleté. And we've seen really nice results because the mechanism's the same. In all of these areas, you just have too much skin, and we're removing skin at a micro level. So a lot of innovation coming on the clinical science side of things. In addition to that, we're innovating when it comes to the hand pieces that are used to do these procedures faster. So, for us, we know that for the patient and for the healthcare provider, we want to get a really good result, and we want to do it as quickly as we can. And so in your meeting with Shiv was really focused on, okay, how do we have optimized consumables and optimized hand pieces to treat different areas of the body? So those are works in process. And in addition, we're working on something that I'm really excited about, which is called ellacor 360. This is a digital ecosystem that connects the patient, the physician, and their device. So from the patient's perspective, it's able to, number one, educate the patient on what ellacor is, soup to nuts, as equally as important what it's not, like many of the questions that we have here. Shiv, I don't know if he told you or not, but he came from Google prior to being here. I worked with him in neuroscience, then he went to Google, and now he's here. And he's an expert in artificial intelligence. And so one of the things that he's building inside of this app is going to be an AI function that will be able to help the patient take a picture of the area that they want to improve. And then with a slider based off of real world evidence and AI, be able to demonstrate what a theoretical outcome could look like so that you can have kind of an idea before you have the procedure. And then from there, find a healthcare provider, book an appointment, and then hold your hand from soup to nuts from the day before your procedure with any doctor's orders that Dr. Ronan might write for you, all the way through a week or two after the procedure, just to make sure that you're healing the right way. If you have any concerns, you can contact us, you can contact the doctor, but most importantly, you can just have a kind of a health journey that goes through it. In addition, it can do everything like post a selfie, refer a friend, or schedule another procedure. All those things will be integrated into that device. For healthcare providers, it'll be something that's a single source of truth with all clinical data, all of your patients categorized in there. And this will be something that connects the physician, the healthcare provider, and their device so that we get a smarter device long-term that can be easier to use and just continue to optimize clinical outcomes. So lots of things in the hopper, but it's fun to have something that's new and innovative. And from my perspective, especially, when it comes to technology in this space, when you have devices, you can get pretty geeky pretty fast, and that's kind of our wheelhouse.
That's pretty exciting, and after talking with Shiv, I can see where this is all coming from. He's a pretty sharp guy, and he's a lot of fun. He's a very neat guy. Yeah, he one of the first things he asked me was, what can we do better on the device? And I said, well, right away, there's this and this, that I see. And he goes, next week he's coming with a software upgrade and new tip, and it's exactly those things. So we're pretty excited about that.
Yeah.
All right, Brette, what else we got?
I have a question from Jackie. She wants to know, does ellacor leave a scar?
So no, ellacor doesn't leave a scar. So it's below a 0.5 millimeter, and the core is small enough that it doesn't leave a scar. And so there's some scientists that figured out that actually quite a while ago. But it's taken a long time to get the technology up to speed. But when you remove a core of skin that's below that threshold of size, it doesn't leave a scar.
What about the ideal age for this procedure? That's a question I get a lot on the phone too.
I think age is somewhat irrelevant. It's when you have some laxity that we can treat with this procedure, then it's okay to do. Obviously, we're not going to do children, but if you have laxity and it's amenable to this treatment, then it's probably okay to do.
Cool. And could I ask, Jason, did you mention a website that shows you getting the procedure? Someone's asking about that.
Yes, if you go to Instagram and pull up ellacor Skin, you will see my video that was done by Dr. Jay Austin at Mass General about 2.5 months ago. But for me to work for any company, I've been in medical devices my entire career. I won't tell you how long that is, but it's long. And for me, it's always, would I use this technology on myself, or would I let my mother use this technology? And the answer to that is yes and yes. So I thought it was important for me to have the procedure myself to be able to understand it from a patient perspective. And I'm really glad I did, because it really just kind of resonated on some of the things that we're trying to do here. You can hear patient testimonials about what's happening, but when you actually have it done, you feel it. That's when it just becomes really compelling. And for me, more than anything, was just the tight feeling that you have afterwards. Not a tight feeling that's uncomfortable, but one that just says like, oh yeah, that's right. Now my skin feels like it should. And so that was really the thing for me. But yeah, go to ellacor Skin on Instagram and you can see the video.
Perfect. Thank you so much. So we have time for about 2 more questions. I'm going to take Renee's question. Can you go back to work after 2 or 3 days and cover with makeup?
So it depends on your work. So there's lots of patients I do surgery on that work from home the next day that wouldn't want to be out in public yet. And so after about the 4th day, you could probably apply some light makeup. You're still going to be a little red. But yes, you can go back after 2 or 3 days. And if you don't mind going back a little red, you can go back on the sooner side.
Perfect. Last question from Stephanie. When can I see the final results?
Oh, that's a good one. Jason, how long did it take you to see your result, and when do you feel like it's stabilized?
Yeah, I think there's different elements to this. Like, the skin removal is instantaneous, but you're a little swollen for the first couple of days, so it's kind of hard to really see what's going on. I would tell you about a 1.5 to 2 weeks into it, you start to kind of look at the mirror and you're saying, oh, wow, that looks a little bit different. But for me, I didn't truly appreciate the result until I saw my before pictures. And I had a 3D image of my before picture beside my after picture. And then I said, oh, wow, I had some pretty significant cheek folds, and they're pretty well gone. Yeah. I always had pronounced nasolabial fold, and so that didn't change much. But my lip was the thing that just was like, oh, my goodness. But that, the dermal remodeling's happening for several months. And so it's one of those things to where every couple of weeks you kind of say, oh, wow, that looks a little different. So it's kind of a process. And you'll see some things in a couple of weeks and other things, and maybe it's a month or two. And then you look at that before picture and say, this was a big difference.
Yeah, you're definitely looking good for a 78-year-old man. So, Brett, do you have one more question?
Actually, we're all out of time for questions tonight. That was a good one, though.
Yeah.
I set myself up.
Doctor, is there anything else you want to add before I go over the specials?
So, well, thank you guys all for coming, and thanks to Jason for being a good sport and helping us out tonight. And he's in Boston, and so it's a little bit later there for him. Brett, you want to go over any kind of announcements?
Yes. I just like to say we'll use this one for our blooper reel if we ever get one together. This was so fun tonight. And a couple other things. Give our office a call to schedule an appointment. It's 925-736-5757. Visit us on our website. Take advantage of our new online scheduling, as I mentioned before. And Dr. Ronan, any other closing thoughts tonight?
Well, thanks. There's one other guest tonight. I got Mr. Tahoe here.
Yeah.
And he says hi to everybody. He's just had a haircut last week, so he's super excited. But thank you all for coming. Come see us in the office. You can pet this guy while you're here. And thank you very much. And we'll see you next month.
Bye, guys.